morning, everyone. My name is Sharon Bogan, and I'm with Public Health Seattle and King County. Thanks so much for joining us today. I'd like to welcome the reporters and media, as well as those who are watching and streaming from Facebook Live. We appreciate you tuning in and paying attention to this important issue this morning. The purpose of our briefing today is to provide an update on COVID-19 data, the numbers, and also share information about what we all need to be doing today to prevent a really large surge in cases in our community. So I have Dr. Jeff Duchin, Health Officer for Public Health Seattle and King County, to speak with you all and to take questions from the media. Dr. Duchin will provide some statements, and then following that, we will take questions from the media. I'd like to ask for media that you limit your questions to one question to start off, so that we can get through lots of questions, and then we can always follow back up. So you will use the raise your hand function in Zoom if you'd like to ask a question, and then we'll call on you. So with that, I'd like to turn it over to Dr. Jeff Duchin, our Health Officer at Public Health Seattle and King County.
Thank you, Sharon, and thank you everyone for joining today. As of today, we have experienced 11,577 confirmed COVID-19 cases in King County, with 602 confirmed deaths. Before I get into the meat of today's briefing, I want to acknowledge that as this pandemic continues to unfold, we continue to see disproportionate impacts on communities of color. We know there are multiple factors that are directly impacting the Black community, including long-standing health inequities and systemic racism. And I want to highlight one event taking place tomorrow. The NAACP and Public Health Seattle and King County are hosting a community mental health day, offering attendees access to a 30-minute one-on-one session with a mental health provider. This may be either in person or remote via a private Zoom conference. There will be free COVID-19 testing available to attendees on site, and you can check out our public health social media for details. The increase in COVID-19 cases is continuing, with an average of 132 cases per day over the past week, increased from 40 a day during early June. Last week, we saw 1,032 cases, compared with 278 the week of June 7th. Most, but not all of the increase remains among younger people. Just over a third, or 35% of recent cases in the past 14 days occurred in young adults in the 20 to 29 age range, and over half in the 20 to 39 age range. And almost 3/4 of our new cases are under 40 years of age. We've been working on a large outbreak in the University of Washington students' Greek system. As of yesterday, we've confirmed 131 associated with that outbreak. No hospitalizations, thankfully. And there's something new that we're keeping our eye on, which is a small increase in hospitalizations. The rate of hospitalizations has increased from 0.8 to 1.3 per 100,000 residents over the past 14 days, compared to the 14 days prior. That's a small increase of 0.5 per 100,000, but we're keeping our eye on it. This translates into 37 cases over the past 2 weeks, compared to 21 over the prior 2 weeks throughout the whole county. We don't know if this is going to portend a long-term trend or not. There were 60 COVID-19 patients in King County hospitals in late June, and there were 83 yesterday. And consistent with the increase in cases among younger age groups, we're seeing a shift in the proportion of cases in younger age groups hospitalized towards the 30 to 59-year-old range. However, the numbers are very small, and we don't have a lot of confidence in generalizing the population that's being hospitalized recently compared to the baseline because of the small numbers, but we are keeping our eye on this. Younger people with COVID-19 are less likely to require hospital care, and we have plenty of hospital capacity in the community. All the COVID-19 cases hospitalized represent only 2% of total hospital beds. But because infections can spread from younger people to older community members and to people who have underlying health conditions that put them at risk for severe disease requiring hospitalization, We're currently monitoring the impact of increasing COVID-19 cases in collaboration with our healthcare system leadership, and will continue to do so. The recent surge in cases threatens the health of our community and the health of our economy. No one wanted this COVID-19 pandemic, but we are stuck with it. The disease is as severe as ever, and the risk isn't going away in the foreseeable future. Our challenge together is to manage COVID-19 over the long term, in the zone between total shutdown and letting the virus run wild. We need to accept the tough reality of what that means, which is long-term behavior change and restructuring how we go about our lives to manage the risk. Regardless of our age or personal health status, we are highly interdependent and interconnected. Our success moving forward as a community depends on the ability of every sector of our society to decrease COVID-19 transmission. We all have to pull our weight. So whether it's manufacturing, restaurants, pubs, or other businesses or workplaces, recreational activities, social or religious gatherings, or school or camp, we depend on one another to do everything we can to stop the spread in each of these settings in order for the others to be able to continue to operate safely. Every setting will need to take all possible COVID prevention and safety measures to protect their staff, their customers, and the community. Limit the number, duration, and proximity of close contacts with others. Avoid group gatherings. Wear a mask and wash your hands frequently. Those fundamental COVID-19 prevention measures are relevant today, and they will be relevant for the foreseeable future. We need to make them part of our daily lives. Pay attention to improving indoor ventilation. And remember, just because you can do something doesn't mean you should do it. I want to speak a little bit about what's happening with our expanding education and enforcement efforts around restaurants and workplaces. We have been working to improve our ability to educate and to enforce compliance of the Governor's Safe Start COVID-19 requirements in both food establishments and other workplaces. And we're in the process of developing and fine-tuning this work now. We're beginning to do spot checks at restaurants to provide education, to help them operate safely and identify potential barriers to compliance, which is informing the type of education that we'll be developing. And moving forward, we'll be building on what we learned to develop compliance checklists. We're focused on providing education to help restaurants come into compliance. And if guidance is subsequently not met, we will close establishments until health protection modifications are made in order to protect the health of the employees and the public. All businesses are required to notify the health department throughout Washington state within 24 hours if you suspect COVID-19 is spreading in your workplace, or if you're aware of 2 or more employees who developed confirmed or suspected COVID-19 over a 2-week period. These are requirements in the governor's proclamation. Workplace safety complaints about coronavirus or other issues can be filed with Washington State Labor and Industries. They've got a toll-free number, 800-423-7233. Employees can also file written safety or health complaints at the LNI website. And for the public to report concerns regarding compliance with health orders, you may call the King County COVID-19 Business and Community Information Line Monday through Friday, 8:30 to 4:30 p.m. at 206-296-8. So with that, I'll conclude my prepared remarks, and I look forward to taking your.
Thank you very much, Dr. Duchin. And we'll start off with Chris Daniels, and if just a reminder to also state the news organization that you are working with. Go ahead, Chris. Just give a moment. Out of the gate is always tricky. Chris, are you there?
I am here.
Great, go ahead. Did you have a question, Chris?
Dr. Duchin, technology is fun. My question, when you're talking about the data and the amount of young people that have been infected with COVID-19, I'm wondering, in terms of contact tracing, any sort of research, you obviously know that there's been weeks of protests involving young people in King County. Is there any sort of connection with the large gatherings that we have seen over the last several weeks in King County with the amount of cases that we're now seeing?
Thanks for your question, Chris. We are concerned anytime large groups gather because of the potential for COVID-19 transmission. And we know that when people are in close contact, even if they're outdoors, if they're in close contact for long periods and they're not wearing masks, there is that potential. But I can tell you that we don't have a lot of evidence to link the current surge to those protests or any particular large gatherings. The city of Seattle has been sponsoring testing sites, and they've tested over 4,000 people who have reported going to a large gathering or a protest event, and the positivity rate is under 0.5%. And that's compared to much higher positivity rates in other groups, for instance, our University of Washington outbreak in the Greek system and so on. So although it's quite possible, even likely, that there were transmission events associated with those large gatherings, and I would feel comfortable saying anytime there are gatherings with tens of thousands of people, there will be spread of COVID-19. We don't have any evidence to suggest that that is a major driver. Although because of what we're seeing in the community now with respect to the increasing number of cases among younger people, I would ask those who are interested in protesting racial injustice and systemic racism to carefully consider how they do that and to question whether large gatherings are required, and if so, please do them safely.
Thank you. Anna Boyko-Wyrock from KUOW.
Unmute now. Hi, Anna Boyko-Wyrock, KUOW Public Radio. This week we had on our Seattle Now podcast UW epidemiologist Judith Malmgren, and she was talking about how, given the number of young people getting infected, she would close the bars. Is that something you've talked about, and why not just close the bars or limit alcohol sales?
Yeah, well, thanks, Anna. Those are good questions. There have been a number of large outbreaks described from around the country related to bars and other venues with lots of alcohol being sold. In King County and Washington State right now, bars per se are not permitted to be operating, but only alcohol served in the context of food service. So perhaps pubs that serve food and restaurants. We have not seen outbreaks that we can attribute to bars per se or those types of venues, although, and we're looking hard and we're continuing to evaluate information from our case and contact tracing interviews to see if we can turn anything like that up, because we want to scrutinize those interviews for any possible transmission events that would lead to multiple infections. We do know that indoor gatherings are higher risk than outdoor gatherings, and that gatherings where people spend more time together, like restaurants and bars that are indoors, particularly if they're not well ventilated, like outdoor settings, pose a higher risk. And then, of course, the fact that people don't wear masks when they're eating or drinking also adds to the risk. So I think that that may be something to be considered depending on where this outbreak, how it evolves and where it heads. At this point, we don't have a lot of evidence that bars and restaurants are driving the outbreak. We believe that there's a lot of socializing going on in the community in general, both in commercial and private settings. So at this point, it's something that we are keeping in the menu of potential opportunities to help our community recover from a surge in COVID cases, and probably will depend on where this outbreak heads in the coming weeks. And it's really just a question of decreasing opportunities for people to spend a lot of time in close contact without wearing masks in places that are not well ventilated. And bars and restaurants and other indoor settings that meet those criteria would be the types of things that we would have to consider if we were going to walk back some of the current activities that are permitted. So there may be other venues also besides bars and restaurants where people spend a relatively long time indoors in close proximity with one another that aren't wearing masks and where they're not as well ventilated as would be ideal to decrease COVID transmission risk.
Thank you. Ryan Blethen from Seattle Times.
Questions. One, if you're not seeing cases from protests or from, say, bars and restaurants, what is the contact trace investigation showing? I mean, where this increase in cases is coming from? And another question would be, now that we're a couple weeks past, as cases started to rise, what are you seeing with the numbers of deaths? Are those starting to increase also now that we're kind of getting down the road here?
Yeah, okay, thanks for those two questions, Ryan. So the first one, it's difficult for us to find a smoking gun for any single person's transmission, and we look for risk factors that people share in common. And just in general terms, we believe most of the cases are associated with either essential work, community transmission events, and I'll talk more about that, or household, secondary cases that spread within households. Now, within the community, this is where we're really interested in trying to understand what's happening, and it's proving very challenging. We are looking for every place somebody's been in 14 days that might have been a public venue. We're finding small things that relatively few people have in common, but nothing that would explain the big picture. Although putting together the different varieties of exposures that people have, we categorize them as social. So people do go out to bars and restaurants, but they also do a lot of other things together. They work, they've had family gatherings, some people have traveled, there have been birthday parties, there were graduation events, and there are these protest gatherings and other gatherings of people for political purposes or free speech related gatherings. All of those undoubtedly pose transmission risks. What we're not seeing at the moment anyway, and we're continuing to scrutinize our data and look at it as carefully as we can, but at the moment we're not finding any one driver. So I'm confident to say that the increase in cases is due to people doing too much in close proximity with one another. But there's lots of different activities apparently that people are doing that are leading to COVID transmission. So some of those may be things like eating and drinking in restaurants and bars, but a lot of that may be socializing with friends and family outside in too close contact, or particularly indoors, at homes. And what happened at the UW, for example, the Greek system, lots of congregating and gathering in lots of different venues. So although I can't point to one particular driver of the increase in cases, we feel confident that this virus only spreads when people are in close proximity, or it spreads most effectively when people are in close proximity for too long a period without using masks. And that's what's happening in our community now. People are doing too much too soon without taking the appropriate precautions. With respect to the deaths, yes, so typically what we see with COVID in general is when cases rise, hospitalizations lag behind cases by 10 to 1 to 3 weeks, let's say, and then deaths even more lag by another couple of weeks. And when you're looking at these types of trends, the age group of the population is very important because younger people are less likely to be hospitalized or die, and older people are more likely. So at the beginning of the pandemic here in King County, it was being driven primarily by older adults, many of whom were in long-term care facilities. And there was a high hospitalization and relatively high case fatality rate. But now, with many, many young people becoming infected that don't typically require hospitalization, we would expect to see a lower rate of hospitalization, so fewer hospitalizations for every 100,000 people who become infected per se, and then fewer deaths. But as those infections spread into older adults or others who have high risk conditions that place them at higher risk for severe disease and hospitalization, we may see that change. And the reason I think it's so important for folks to understand the long-term threat that COVID-19 poses is because this virus doesn't stay in one group. It won't stay in one group. It will move around from one age group to the next as it gets out of those social networks. It will take every opportunity to find anyone that we have contact with. And so slowly it will most likely impact other age groups and other populations that may have higher risk. So for us to avoid that, we need to take precautions in every possible sector of the community, you know, business, workplace, recreational, social, gatherings of faith, school, camp, sporting events. Everything that's happening right now presents a potential risk for transmission of COVID-19. And in every one of those venues, extreme measures have to be taken, or I should say not extreme measures, but the measures have to be taken extremely seriously to prevent COVID transmission. Again, you know, less than 5% of our population has been infected by this virus. It's going to pose an ongoing long-term risk to us. So we need to learn how to live with it. We need to fundamentally change the way we interact with one another, the way we go about our lives with respect to proximity to one another, paying more attention to mask use, staying far apart, decreasing prolonged contacts, and things like ventilation, indoor ventilation. This isn't something that we're going to be able to manage for weeks or months and then expect to be able to go back to the way we were pre-COVID. You know, the virus is going to be out there waiting until we give it opportunities to infect us, and then it will do just that. So we need to change our behavior over the long term that will decrease the virus's ability to infect us so that we can go about our business and the activities that we want and need to do as safely as possible. And if things get too out of control in any one sector, that gives all the other sectors less wiggle room. So if we're seeing lots of cases occurring in workplaces, that will impact, you know, the community at large. And if we see lots of cases occurring in social venues, that will impact the ability for workplaces and schools to operate safely. There's only so much transmission that the community can manage before the healthcare system will become overwhelmed. And so every sector has to understand how codependent they are and how interdependent they are on the other sectors to be able to operate.
Thank you. Nick Popham, go ahead.
Hey there, Dr. Duchin. It's Nick Popham from Como TV. One of my questions, I was interested in when we might know the effects of the 4th of July. I know it's generally, I think, about a couple weeks. Are you concerned at all about the people who went out during the 4th of July? Is that something that we're going to be seeing maybe in a week or two? And then also about hospital capacity. Is there a specific, I guess, percentage of hospitalizations that we'd reach before we'd have to shut back down? Or are you monitoring, say, like a certain level? If it's at like 25 or 30%, we'd scale back a bit. Is there a specific number?
Yeah, okay, good questions, Nick, thanks. So yes, I'm worried about what happened over the 4th of July. You know, anecdotal experience and stories suggest that there was a lot of socializing happening. We saw it, you know, we both in person and on social media. And there is a real possibility that the recent increase will get even more severe, more people become infected over the coming weeks. since early, or I guess Memorial Day in early June, people seem to have started socializing more, doing more, getting more active, and forgetting that COVID-19 is still circulating widely. And so we want people to be able to do what they desire to the extent possible, but it has to be done safely. We can't expect to socialize and do holiday parties and other gatherings in the era of COVID without taking precautions against COVID and not suffer from the consequences, which are increasing numbers of cases, and ultimately there will be hospitalizations and deaths associated. It's just a question of which groups become most affected and whether we can contain transmission within those groups by stepping up our adherence to these prevention guidelines. With respect to the hospitals, there are lots of factors that are important in understanding when we might need to do something differently in the community to protect our healthcare facilities. So we monitor the availability of hospital beds, which is critically important, both regular beds in the hospital and intensive care unit beds. But we also track things like their staffing, can they staff those beds, their absenteeism, the level of personal protective equipment that they have, and so on. So there isn't any one, early trigger that we would say we have to stop. It's a combination of a variety of different healthcare system related measures. Just bed availability, acuity, so ICU unit availability, the ability of hospitals to staff their beds, and the amount of personal protective equipment that they have available, and so on. So we look at all those factors. We look at the trends, the rate of increase of cases, and what we would predict happening over coming weeks if we see cases rising at steep level. All these things will be taken into account and discussed with our healthcare system leadership, and we use our Northwest Healthcare Response Network, excuse me, Northwest Healthcare Response Network as the convener of our healthcare system leadership in collaboration with Washington State Department of Health. For the past 2 weeks, I've met with our local leadership in the Northwest Healthcare Response Network leadership to review what we're seeing. And right now, there should be no worries about hospital capacity. Again, I said earlier, only 2% of hospital beds are filled with COVID patients. There's lots of available beds, both in the ICU and in the general floors. Anyone who believes they need medical care for any reason should feel safe in doing so after contacting their healthcare provider. Hospitals can provide care for any type of condition that's needed currently. But again, we're just really interested in getting as much warning as we can so the healthcare system can prepare. And we look at every day each of those factors and then try and make assessments of both where things are headed and whether we need to do anything differently.
Patrick Quinn, go ahead.
Hey, thanks for your availability today. You mentioned long-term behavioral changes are needed, and just because you can do something doesn't mean you should do something. When it comes to travel, practically, how should we travel? It's the summer. This is the Pacific Northwest. Planes, what should we keep in mind about big travel, but also to the coast or to state parks? Practically, what would you advise?
Yeah, that's a great question. There's a lot in there with respect to travel. I mean, air travel is different than traveling in your car. In general, if you're going to be in contact with people outside your family, there's risk involved right there. And then you have to measure a couple of things to understand how much risk is involved. So that would mean how many people outside your family will you be in contact with? Will it be close contact, and how long will you be in contact with folks? And then for air travel, of course, there's the whole issue of being on an airplane, which is not the greatest environment for air circulation. It's a closed relatively closed space. So there's risk involved with air travel. Of course, the risk is related to the duration of the travel. Same with any sort of closed conveyance, bus or train or car, if there are people from outside the family in the car. So just getting some feel for, how many other people you'd be in contact with. And then you still also want to think a little bit about the environmental risk related to acquiring COVID from just things that you touch. It's a lower risk than it is through close contact with people, but it's not something that can be ignored. So, common surfaces, the more you're going out in the community and touching things that other people have touched, that would place you at higher risk. And then finally, the community that you're traveling to. If you're traveling to a community where there's a lot of COVID happening, that's a significant risk. So right now, of course, we've been all reading about the terrible outbreaks that are happening in parts of Texas, Arizona, Florida, and even within other states, some communities have higher levels of COVID happening than others. So understanding what the COVID risk is like at your destination is very important as well. So travel does pose risk, but there's a lot of different types of travel, and the risks that different types of travel pose are different from one another. So thinking through carefully, what your itinerary will be and the types of contact people will have with others will help understand the risk. I think in general, people who are older and who have underlying health conditions should take more precautions, whether they're traveling or not. They need to understand that they're at higher risk and should really be minimizing their contact with others to the greatest extent possible.
Paige Browning from KUOW.
Hey, Doctor. Paige Browning here from KUOW. I've got a question about this first wave of cases that we're in. We're seeing an uptick in King County and Seattle and the state. And we've also heard rumors that maybe a second wave of cases comes in the fall or at some point in the future. I'm wondering what marks a transition between the first wave of cases and the second wave of cases, and does that even matter?
Yes. So, the wave business is, it's a term people use based on past influenza pandemics, where there was a pretty well-defined peak, and then the influenza activity sort of simmered down and then came back big time in the fall with a much larger peak in many communities. With COVID, it's not clear that that will be the same. Some communities suffered first waves, and you could consider a peak of activity to be a wave, but we haven't actually suppressed activity, and I'm not sure that you could say that the first wave ever ended really in most of the U.S. and even locally. We're seeing ongoing activity. So whether you call it a wave or just persistent activity, I think that's a matter of semantics. There's definitely a very high likelihood that we're going to see much more risk coming into the fall and winter. I think the consensus among people who are studying COVID and who are either scientists or public health professionals, we all believe that there's going to be a significant uptick in activity related to the weather change, which drives more people indoors where the risk is higher, possibly related to temperature and humidity effects, and largely also related to things that we just don't understand about how emerging viruses work, and a lot of speculation about whether this will or will not replicate the wave phenomenon that's seen with influenza. So, I don't feel strongly about the terminology, whether we say we're in a first wave now or a second wave is coming later. I do think that we're having significant activity currently. I don't think we ever suppressed our first wave, either locally or nationally. to the degree that I would have liked. And that's why we're seeing ongoing transmission. But I'm very confident that we'll see much higher levels of transmission in the fall and winter. And that's a reason why people really need to take the opportunity now, where we're seeing relatively manageable transmission, to make the changes that we need to make in our personal lives and our businesses and our workplaces, that will really decrease transmission as much as possible while allowing us to function as a community, because the threat is going to be much higher soon. And to the extent that we're prepared, we will be able to weather that storm much more safely with fewer severe illnesses, hospitalizations, and deaths. But if we continue to ignore the basic behaviors and protective measures that are required to prevent transmission, we will be taking off into that high-risk time of year at a much higher level of disease, which will mean that we will have ultimately more cases and more severe cases than we could have had otherwise, had we suppressed the transmission more successfully.
Thank you. Will James go ahead?
Hi there, can you hear me?
Yeah.
Yes.
Okay, so we know that younger people are much less likely to be hospitalized or die from COVID-19, but I'm wondering about your assessment of the things we've been learning about risk of long-term ailments resulting from even mild COVID-19 infections, things like mini strokes, organ damage, that sort of thing.
Yeah. So this is a new disease, and we don't know a lot about the long-term sequelae and all the different types of health problems that it can cause. And it's clear that young people don't have to go to the hospital and don't die at high rates from this disease. It mean that it's an insignificant problem, or that it won't cause real hardship for people, either in the short term or the long term. We just don't know a lot. There are new syndromes being described all the time, more chronic manifestations, fatigue, trouble breathing over long periods, and then some neurological issues that people are reporting. Thankfully, these are relatively rare, but I want to remind you that only a very few % of the population have been infected. And so if we take even these relatively rare and serious complications over a large population, that will mean many, many people will be having significant health problems from COVID. And that's why we really need to emphasize the importance of decreasing the number of people who get sick and can transmit the infection to the greatest extent possible, because even rare serious side effects, or not side effects, health effects or complications can affect many, many people when almost all the population or even half the population become infected. What we're looking at now is, maybe 5% of the population max locally and nationally, and all the illness and complications and hardship that you've read about and are familiar with is based on the fact that 95% of us haven't even been infected yet. And we don't want it to get to the point where we have huge numbers of people getting infected very rapidly, because the numbers of people who develop complications, even though they may be small percentage-wise, can get very high very quickly.
Thank you. And I wanted to ask Dr. Duchin a question from the community over Facebook that's coming in, which is about contact tracing. So I'm curious about the success of contact tracing and dispelling rumors that people protesting aren't answering contact tracers. Is there anything you've heard about that, or could you share a little bit more about how contact tracing is going here at Public Health?
Yeah. So just by way of background, we are building our contact tracing capacity of public health. Currently, we share the work with our colleagues at Washington State Health Department. And so although when cases were low, we were looking to manage most of them in a very short time frame. With the recent surge over the past 2 weeks, we've managed about a third or 35% or so, and the remainder have been managed by the Washington State Department of Health contact tracing group. That said, we haven't heard anything about protests, and I talk with my team all the time. We haven't heard that people are systematically declining to participate, and no one's mentioned that they're doing that intentionally. Some people may not be able to be contacted, and we don't know why if we don't contact them at all. But we do contact almost 90% of the cases, and we haven't had that particular problem. And again, I just want to reemphasize that the whole point of case and contact tracing is to stop the spread of COVID-19 as quickly as possible. So with case identification, anyone who has a COVID-like illness should isolate themselves right away. But once a diagnosis is established, the healthcare provider should reach out to that person and let them know they need to isolate themselves, and also let them know that other people with whom they've been in close contact need to be tested if they have symptoms and isolate themselves as well, but also be quarantined if they don't have symptoms, and tested if they develop symptoms. And then someone from public health should follow up and offer assistance in helping people comply with isolation or quarantine, trying to understand what their needs are. And if we can help in any way, if it relates to providing a safe location, if they want to be away from others who are vulnerable, or if we have facilities, or if they need help with food, medication, other social services, we want to provide it so that people can stay in place and avoid spreading the infection to others while they're sick. The other key reason we do case and contact investigation relates to what Ryan Blethyn asked me earlier, which is we want to understand where transmission is occurring in the community. And to do so, we need to talk to people and understand what they've been doing during the time that they may have been exposed. And then we look for commonalities among all the different people. So we can identify, for example, common locations where cases are occurring, and then we can go there and understand what needs to be done to decrease the risk to others in that location. And that could be a workplace, it can be a business, it can be a social venue, it could be a school, anywhere. So for those reasons, it's really important for us to be able to talk to cases and their contacts. And we are still successfully contacting a very high proportion of those that we take on. We are being challenged, though, by the increasing number of cases and the burden that that's placing on the overall system. And we're not able to do as many as we would like currently, but we're rapidly trying to bring on more help so that we can ultimately keep up with the number of cases that are occurring and be able to interview all of our King County cases here with our King County staff.
Great, and one final question from Ruby. Go ahead.
Oh, hi. This is Ruby DeLuna at KUOW. My question has to do with spot checks on restaurants. So what would trigger a closure? Does it take one positive case from an employee? And then on the flip side, when are restaurants allowed to reopen once it's been closed? Thanks.
Yeah, thank you. Spot checks are random, but if we have complaints or if our investigations turn up cases linked to workplaces, we'll do an investigation. One case does not trigger a closure because there are so many places in the community where someone can acquire COVID. We would never, be able to attribute someone's infection to a workplace or anything else that they did in the past 14 days without having other cases or other circumstances that would implicate that. So for, if theoretically, that was the only place someone went, then you might say, okay, we have to take that seriously, but that's really not a realistic scenario. So we look for clusters of cases. And again, it is required in Washington State by the governor's proclamation that businesses, including restaurants and food service establishments, report to us when there's been transmission in the workplace. So if they have a couple of cases, more than one among their staff, that should be reported to us. And when we then do an investigation, if we identify that there's something at that workplace that's contributing to spread, and that issue can't be resolved quickly, such that there's an ongoing risk to workers or the customers, that could trigger a closure. We also look for other key elements that are required of businesses to operate safely, such as adequate distancing, social distancing between customers and workers, such as mask use, such as occupancy. If they're obeying the restrictions on occupancy and not going above the permitted level of occupancy, all those things would be looked at. And when a facility would be able to reopen depends on what we find and how quickly those issues that might be putting people at risk in that setting can be resolved. So there's no standard time that anyone would need to be closed. Sometimes there may need to be some environmental cleaning, but just pretty easy to do. That doesn't usually take very long. But sometimes there are some process issues that need to be implemented, for example, a system for screening employees for symptoms, or something physical in the workplace that needs to be done to rearrange so that there can be safe distancing. Sometimes that can take time. And then, of course, the rate at which people comply or provide the information that suggests that they've taken the appropriate steps, will determine when we can reopen. We generally like to open places up again as quickly as possible because we want businesses to be able to operate safely, and we want them to be able to do their business to the greatest extent possible safely and in a way that doesn't put their employees and the public at risk. So we don't have any interest in drawing out the times at which workplaces may need to be closed to address COVID safety issues. But for each workplace, depending on the particular circumstances that led to the closure, it may be as short as a day or multiple days, depending on how long it takes to address those issues.
Thank you. And with that, we'll wrap up. Is there any final words, Dr. Duchin, that you wanted to leave either the public or the media with today?
Well, I would just, first of all, thanks for joining. I just think that it's just critical that as a community, we understand the long-term nature of this COVID-19 mess. I mean, none of us asked for this, none of us wanted this, but it's with us and we have to deal with it. And if we don't deal with it, it will deal with us, and it's not going to be in a good way. So if we're going to have the types of activities that we want to have as a community, socially, individually, personally, and economically for businesses and workplaces, we need to be smart. We need to do the things that will decrease our risk of spreading COVID to one another. And we need to understand how interrelated we all are. Every sector depends on every other sector. Workplaces depend on one another, regardless of what type of business they're in. Schools depend on workplaces and communities to be able to operate safely. And we depend as individuals to do the types of things we like to do recreationally and socially with our free time, on the ability of all the other components of our community to operate safely so that we don't get exposed doing the things we like to do. So we need long-term behavior change with respect to how close we get to one another. We need to institutionalize the distancing, wearing of masks, anytime we're in public and in close contact with one another, especially indoors. Paying attention to ventilation, decreasing the duration of contact, the frequency of contact, proximity of contacts, and good hand hygiene. And then reconfiguring our workplaces and any other place we spend time to allow that space that's necessary to decrease the risk of transmission. All of these things, they're not short-term fixes. These are long-term behavior changes. The virus will not be going away anytime soon. So anytime we step away from those required, prevention steps, we will see cases recur, we'll see transmission increase, and we'll suffer the consequences both in our healthcare system and in our economy. So for a healthy economy, we need a healthy community. And so understanding how interconnected and interdependent we are and the steps we need to take long term just are the most important thing right now.
Thank you. And the entire briefing will be available on Public Health Seattle and King County's YouTube page later today. So you're welcome to take a look at that and share with your networks. I want to thank again the media and our community for weighing in, asking really important questions as we try and navigate this situation, which is clearly a long-term situation. So I'm thankful to you all for participating. I'd also encourage you to follow publichealthinsider.com, our public health department blog. We aim to provide information on that blog weekly, if not much more so, and that includes COVID-19 related issues, but also many of the other public health issues that continue to impact our community. So with that, thank you all and have a wonderful Friday.
Thank you.